Why not try something smart to chew on? The Lunchroom on RCI, Monday to Friday, 12:45 to 2 p.m. The Lunchroom, informative, enlightening, provocative, engaging. The Lunchroom on RCI, food for thought. The station that gives you, more lunch.
Good afternoon and welcome to the Lunchroom on Radio Caribbean International. It is Monday, December the 11th, 2023, and this is program number 1111. I'm your host, Calix George Jr. Now, in addition to Radio 101.1 FM, you can also get us at our website. It is... Hyper is laughing away. And of course, you can also get us at our website, and that is rcistlucia.com. We are also streaming live on our YouTube feed. Just search for the official page of Radio Caribbean International on YouTube, and of course, be sure to subscribe to that page and like it as well, please and thanks. The number to call in to tell us what's on your plate today, it is 452-3046. Again, 452-3046, as well as our WhatsApp number. You can call in to 724-0008. You can also message into that number, that WhatsApp number. Again, it is 724-0008. Now, in a bit, we're going to be discussing universal health coverage, and we're going to be discussing that with the Director of Universal Health Coverage in the Ministry of Health and Wellness and Elderly Affairs, Dr. Alicia Eugene Ford. But first, some birthday greetings going out to a few people. Mr. Marthas Peter, happy birthday to you, sir. And we do hope that you're having a splendid birthday celebration. Also sending greetings out to Mr. Emran Matthew. He's celebrating his birthday today. And we do hope that you're having a fantastic day as well. We're also wishing Miss Leah Yard happy birthday. And we do hope that you're having a wonderful day. Enjoy to the max. As well as to Miss Noel Mentor. Happy birthday to you. And we do hope that you're having a splendid birthday celebration. Bit of history for today. In the year 1792, the French King Louis XVI went on trial accused of high treason and crimes against the state. 1913 saw the Mona Lisa recovered after 2 years being stolen from the Louvre Museum. 1931 saw the Statute of Westminster giving complete legislative independence to Canada, Australia, New Zealand, South Africa, the Irish Free State, and Newfoundland. In 1946 saw the establishment of the United Nations International Children's Emergency Fund, UNICEF, established by Resolution 57-1 of the UN General Assembly. And in 1997 on this day, delegates from 150 industrial nations attended the UN Climate Conference in Kyoto, Japan, and reached an agreement to control heat-trapping greenhouse gases. We now move on to our dish of the day. The Daily Dish is brought with the kind compliments of our good friends at Tiles Plus.
One tiles for your home, I see. Bathroom, kitchen, pantry. Need tiles for your balcony. Come down to Tiles Plus, satisfaction guarantee. Tiles Plus, Tiles Plus, Tiles Plus. Big tiles with unbeatable cost. Customer service, A+. With all kind of tiles, come down to Tiles Plus. We also got gasware and vanity. Books, doors, you'll see. Come down, don't mind nobody. We got the best tiles on island. Trust me. We are located Land Street in Castries, Bosses Grozile, and Slack Street in Beaufort. Telephone number 453-7939.
Serving now, the Daily Dish.
And welcome back to our program for today, this Monday. It's, of course, our last week, in fact, the last few days before we end programming for the year 2023 here at the Lunchroom. And, of course, it's a good opportunity to do some recapping, to see progress made in a number of different sectors, a number of areas of concern and importance to us here in St. Lucia, and certainly healthcare is one of those really important areas which has been progressing over the year. Tomorrow, the 12th of December, marks a Universal Health Coverage Day. And we're so very pleased, in fact, to be able to mark that day with a bit of a synopsis as to the amount of work and the effort that is being placed currently into the matter of universal health care or universal health coverage. That has been, of course, a very topical matter in St. Lucia for perhaps one can say decades now. UHC, as it has often been branded. And to tell us quite a bit about just that, we're so very pleased to have Dr. Alicia Eugene Ford of the Ministry of Health. She is the Director of Universal Health Coverage within that department. Dr. Ford, thank you so very much for joining us here today at the Lunchroom.
Thank you and good afternoon, everybody. So tomorrow, the 12th of December, is International Universal Health Coverage Day. And we found it quite important to inform the public of the work we've been doing at the Ministry of Health, Wellness and Elderly Affairs. To start off, I would like persons to know, I usually start off by telling them what is universal health coverage, or what we call UHC. It's when everyone receives the health care they need, when and where they need it, without going through financial hardship or ruin, and that's very important. The Ministry of Health has already started work. A lot of work has been done before, and I always take the opportunity to thank all my colleagues who have done a lot of work before, laying the foundation or setting the foundation for UHC so that we can move forward. We have a defined essential package of health service, and after COVID-19, it was necessary for us to review it because we know COVID-19 dealt a blow to our healthcare system, so it was necessary for us to review the essential package of health service, which is services the basket of services we want to offer St. Lucians, to see if there's any other services we needed to include after COVID-19, and we did that. Just to inform persons of some of the services within the basket, we're looking at hypertension, you're looking at diabetes, maternal and child health services, cancer, HIV, AIDS, tuberculosis, syphilis, COPD, which we call chronic obstructive pulmonary disease, asthma, heart attack, stroke, sickle cell disease, dental care, and eye care. And these are just some of the services within the basket. We are costing the services within the basket. That's important. You need to cost the services, but we're also working on our health financing policy and strategy, which will give us guidance on how we're going to pay for these services. So you're looking at pooling of resources, and at the same time, how do you purchase these services? So that's very important. The health financing policy and strategy, we've been working on it over the past few months, along with not only Ministry of Health, Ministry of Finance, Treasury, etc., and the World Bank. They've been supporting us so that we can work towards having this health financing policy and strategy, which we are working on. Persons will know that on the 1st of June, we launched the maternal and child health services under UHC. And that is expectant mothers were asked to access the wellness center so that they can get all the routine labs that you get during the pregnancy, as well as the ultrasound, one per trimester, through the wellness centers. So it was important that we monitor this service, and we can say from 1st of June into September, we can say that we have 546 new clients from June when we started into September. And we compared that period to our last period of last year and realized last year, around that same period of June to September, we had 420 new clients. Okay, so we're looking at an increase of just about 126 clients. We are continuing to collate information for the month of October and November, so we can give our quarterly reports to see how we are doing. And that's important because while we're looking at our numbers, we also have what you call our key performance indicators to see how our program is going, as well as we have our survey online, hard copy. You can get it, because we have people, you can also call in, because we really want persons to tell us if they're satisfied or not with the service, and if there's room for improvement for us to do the necessaries. And we continue to do our sporadic visits on ground to make sure that things are going how we want it to do. So the monitoring is important. We have to look at which areas that we have more women coming in. And we're looking at areas like, for instance, Health Region 1. When I say Health Region 1 for Ministry of Health, I'm looking at the Grosedet Polyclinic, the Grand Riviere Wellness Center, the Moshi Wellness Center. These are areas where we have a high intake of new women coming in. We also have Region 8A and 8B, which is Castries and its environs. So you're looking at Castries Wellness Center, Laclery, Enchipo, Bexar Wellness Center, Cicerone Wellness Center, Chiroche Wellness Center. These are areas that have increases. Viewfort as well, for Health Region 5, Viewfort Wellness Center. We have Bellevue Wellness Center as well. And we have Saltibus, Grace, and Labrie Wellness Centers are areas where we see a high increase or an increase in the women coming in. When it comes to our ultrasound services, we have 8 ultrasound services on island, and we've been using them from June when we started into presently. We have 962 ultrasounds that have been done under that program for women that are using the universal health coverage. And of course, the labs, we have St. Jude's and OKUH, or Millennium Heights. And what what has been happening is that the lab technologists, they come to the wellness centers. And that's important so that the women don't have to leave their communities and go to the lab or go find a place to get it done. The labs come down to them in the wellness centers. Okay, so they get vouchers and right there at the ultrasound in the wellness center, and these vouchers can be used so they can get their labs done right there at the wellness centers, and as well as get these vouchers with the ultrasound forms to access any of the 8 areas on island that do ultrasounds. So when it came to our labs, for the period of June to October, we had 1,147 clients coming to do the lab tests, out of which 350 was serviced by St. Jude's Hospital phlebotomists or lab technologists, and 797 were actually serviced by OKUH under Millennium Heights Medical Complex. One of the things I want to say as well is that patients who are accessing the private sector, private sector clients, we do not disadvantage them. We give them the go-ahead as well to use these services, because we know they have persons who are accustomed with their private obstetrician gynecologist and they want to continue that relationship. We do not want them to stop that relationship, but we want them to know that they too can access the services. So what the private obstetrician gynecologist would have to do is just write a letter, a short referral note, letting them know that this is this patient and this patient will come in. The nurses will still see the patient. The midwife will still see the patient. They will still see the patients and examine the patient, but they will still, allow them to go ahead and access the labs and the ultrasounds through the wellness center with the UHC vouchers.
You mentioned 8 centers where that is
8
available.
ultrasound.
So is it one per region? Is
no,
that how, okay.
the eight ultrasound services we used for the period from June forward. Rodney Bay Medical in the north. Rodney Bay Medical. We have also the radiology clinic that is in Tapio Gablewoods Clinic. That's actually in Tapio Hospital. We also use in Medical Imaging Inc. And there is also a Southern branch of Medical Imaging Inc. Helen Diagnostic Center. That is Dr. Tusha Mirajka. He's in Brazil Street, corner of Brazil and Broccoli Street on this end. We also have other individuals, for instance, like Dr. Christy Philogen, who has the Get Well Clinic, and he also has a clinic in Dennery, in the village of Dennery. And in the south, we've been using Dr. Richard Butt, which is St. Anthony's Medical Center, and Dr. Leonard Lashley's X-ray and ultrasound clinic. So it's across the island.
I see. Okay.
It's across the island. One of the things, though, we're really, really asking persons to do is to, when the pregnant women who are pregnant, to call the wellness center before they come in. And that's important, because what we do not want is for you to go and then they tell you, I'm sorry, we're not doing maternal and child health clinic today. We're doing hypertension, a diabetic clinic. We're doing a pediatric clinic. We're doing another clinic, because there are different clinics scheduled for different days. And therefore, it is important that persons take into consideration that when they call, they get to know when to come. An appointment is made with the nurses, and we advise them or we encourage them to walk with a valid ID, because we want to ensure we have your proper name in our health information system. Because we don't want persons to come and then the spelling is wrong or you use another name. So we want you to walk with your ID so that we can get the proper name is placed within the system. Okay. We also have what you call, and that all of these things are happening or started throughout the year, the performance-based financing pilot project which is the PBF project, spearheaded by Mr. Neham Jean-Baptiste, who is the PBF coordinator. That particular project focusing on screening and treatment of hypertension and diabetes. Before, we had a pilot project that happened before. Persons would have known years ago, if you had diabetes alone, or if you had diabetes and hypertension, you could have gotten free medication at the wellness center. But this particular one is different in that whether you hypertensive alone, or you diabetic alone, or you hypertensive and diabetic, you can get screened and you can receive treatment, which includes seeing the physician, getting your medication, but also getting your labs at the wellness center itself. So you don't have to leave the wellness center. You can actually go to the area itself, the wellness center, and the nurses will tell you exactly when the lab technologists will be coming on ground. So far, 8 areas or 8 wellness centers are included in the PBF pilot project, and I'm looking at Richford Wellness Center, Dennery Hospital, Monrepo Wellness Center, Deriso Wellness Center, Lafargue Wellness Center, Soufre Wellness Center, and we're looking at Lacroix Mingo Wellness Center and Jacmel Wellness Center. That's phase 1. In phase 2, which is coming soon, we'll have an additional 9 wellness center, and the aim is to expand this whole hypertension, diabetes screening and treatment under the wider umbrella of universal health coverage. So that's important that this is ongoing, that persons know that this is ongoing. One may ask, but what is the plan for the future? What are we looking at? And I know I mentioned the essential package of health services, but we plan to do it in a phased manner, phase by phase, as we say in French Creole, tipa tipa no kai fei. So it's important that persons note that. So we're looking into screening of persons with cervical cancer, screening at the wellness center, people with prostate cancer, for prostate cancer. So when you come to the wellness center, we want to be able to screen you if you want to see if you have cervical cancer, if you have prostate cancer. We want to be able to strengthen that because it's done if persons come in, but we really want persons to see it as something under universal health coverage and take advantage of it. We're also looking at chronic kidney disease. We know very well that dialysis is very, very expensive. And then most persons, a lot of persons who are on dialysis would have to tell you that they have to do 3 sessions per week, and that is costly. So it is important that if we can screen for chronic kidney disease early enough, we prevent you from getting to that phase where you warrant dialysis or maybe consider transplant in another country if you're very young or you reach the criteria for that. So it's very important that we look into these services and we push in this service. We're looking to give these services as soon as possible and additional services. As time goes, we will inform the public of the services that we are going to give, but a lot groundwork has to be done before that. We have to do training of our healthcare workers. We have to first engage them to see, listen, we want to give this service. What do you think? Do you think we are able to give it? And what do we need to make it happen? That's a needs assessment, which will involve maybe purchasing of equipment, relevant training, etc., developing key performance indicators, developing standard operation procedures. Let us look at our clinical guidelines. It may look into reviewing clinical guidelines or developing. So all of these are important things that has to be done before we decide to launch a service, the groundwork, so that when we decide to launch it, everybody is on board. And that not only includes the staff members who will be delivering it, but the different associations. So if, for instance, we're doing chronic kidney disease, the Renal Association people should know we are launching because they are stakeholders, and it's important that they come on board and they'll be able to assist us on certain things and we're able to guide them as well. So it's very important that we have that. We also have under the project implementation unit what we call the 2 projects, Health System Strengthening Project as well as the Regional OECS project. And we've been getting a lot of assistance under that project implementation unit to ensure that we have equipment when it comes to certain areas within the healthcare system, simple things like furniture as well, vehicles. And you may, if you're looking at, sometimes you realize that they actually purchase and there's a handing over ceremony of an ambulance or handing over ceremony of a vehicle and all of these things make working environment easier and also will improve the healthcare that we offer to St. Lucians. We're also looking at smarting some of the wellness centers, making them be able to be resilient. So you're looking at, for instance, if there's a hurricane, or you're looking at the amount of water stored, you may have to look at how it's constructed, the robustness of internet, and all these things to make it more resilient or make it smarter. So that is some of the things that will be happening under the PIU, OECS regional projects, and of course health system strengthening project, which will allow us to strengthen our facilities, and in certain cases make our staff feel more comfortable so that they'll be able to deliver these services. So that's important as well. We also have what you call consultancies that are taking place, including our Universal Health Coverage White Paper, which is being drafted. We have a lead drafter and a co-lead drafter. They've been working on this. So they almost completed. In other words, that they have to get information on other things that are happening simultaneously to feed into that white paper, which is a roadmap to attain UHC in St. Lucia. And they're working on this. We also have a separate consultancy dealing with the costing of the essential package of health services, and that's important. We're looking forward to have more work being done when it comes to our health management information system. When you look for quality services under universal health coverage, quality assurance under universal health coverage. So there's so much work in the pipeline has already started, and others that we plan to do, because we know that to attain universal health coverage, there are a lot of pillars you have to look at, and these pillars will include service delivery, health information system, financing, equipment and vaccine, and all of these things, legislation as well. So all of these are important pillars to attain UHC, and therefore they need to be looked at so that together and looked at and planned so that they interlock with each other, because at the end of it, you need to look at all of this to be able to attain UHC. What else have we done for the year?
Well, before we even get to that, though, coming to the matter of perceptions, we have a lot of issues of perceptions, given the past, the history of healthcare and the challenges there. And a lot of people perhaps don't have a lot of confidence in the public health system. And you'll hear that they will prefer to go to a private clinician, or they want to go to a private hospital, or they'd want to go outside of St. Lucia to get a service, or whatever the case may be. Is there a plan to address that issue regarding the issue? Well, I guess you could call it marketing and communication surrounding these issues.
Yes, very much so. Okay, so communication is very important, or marketing, as you say, for UHC. But in addition to this, quality is important. Quality is a very big leg of UHC. You're looking at accessibility, affordability, but also quality is very important. And what has happened is that sometimes persons would probably, as you said, gravitate towards the private sector instead of going to the public sector, because they feel that whatever they get in the private sector is of a better quality than what's the public sector. So under UHC, we are really working together to bring up the level of the public sector so that persons will feel that it is equally important, or they're not disadvantaged, rather, going to the public sector versus the private sector. And that is very important. So quality is a big arm of UHC. And in addition to quality, as I mentioned, you have to also look at communicating or educating the public, because sometimes the public of St. Lucia, they're unaware of what's available within the public sector. So they would probably go somewhere else not knowing that right there within their community, they have certain things that are being offered and they're unaware of it. So we have to do communication so that we educate the public, let them know what's being available. But at the same time, we have to improve the quality of care that is being offered within the public sector, because that is very important. And I also want to say, though, the competition should not exist between the public and the private sector, because for UHC to happen, you need to have what you call public-private partnerships, where you have to have relationships or have service level agreements, depending on what it is, to be able to move forward. Just as I mentioned, we have PBF that's running, and we also have the maternal and child health care. As I mentioned, we have the hospitals coming on ground to get the blood samples or get whatever samples, urine or stool samples, lab phlebotomy services. But for the ultrasound services, although you get the voucher at the wellness center, we had to engage persons in the private sector so that they be able to work alongside us so that we can make that particular service go forward. So it's for universal health coverage, it's not competition, but working together, cooperation, to make sure that the public in no way is disadvantaged, because it's for everyone. It's for everyone.
How is universal health coverage impacting the quality of service at the hospitals right now? Is that part of the
Yes.
whole thematic plan for UHC
Yes.
as well?
Under UHC, well, the plan is very important. First of all, what's happening right now? Let's take maternal and child health, or let's take PBF. When you have persons that are hypertension and hypertensive or diabetics, or persons who do not know, and they come to screen and then they find out and they get treated. And you also have women who are getting their lab tests done at particular areas in the wellness center, and also ultrasounds private sector. It sort of allows them to go towards primary health care instead of going or gravitating to the hospital and flooding the hospital with services that could be taken care of on ground. If you are screened early and you are treated early at the level of primary health care, prevention is a big leg, very important, because primary health care is heavy on prevention. If these individuals can go to primary health care and get screened and treated early, then there is a less possibility that they get so advanced that they have to go to the hospital to be seen and be admitted. That's one of the things as well. We are also looking at the wider Ministry of Health to have certain areas expand hours of services. Okay, you right now, I'm not sure if you're aware, but I'm pretty sure you're aware, the Grosslet Polyclinic is open from 8 a.m. to midnight, Saturdays and Sundays and weekends included as well. So what you'd have noticed that a lot of persons who would have gone to the hospitals after particular hours for fatigue, now they don't really have to go, especially if whatever they have can be taken care of at the primary healthcare level. Plans are in place or being discussed to move Castries Wellness Center into a particular section of the Victoria Hospital section, a particular section of the Victoria Hospital. And when they're in there, they will have access to laboratory and x-rays services, radiology services that the present Castries Wellness Center doesn't have. So when the road or the agenda is to go in that route, to look at areas on island and give them extended hours and additional services. Denry, for instance, is already there. Soufrière is already there. And the government is looking into possibly Vieux-Fort as well to do the same. And they may look at other areas after the Ministry of Health has done the assessment. They may look at other areas to add on. But as long as you can extend the services, including the hours of certain areas that are high traffic, heavy population, for instance, and then you educate the public on it, providing quality services as well, having sufficient human resource, etc., then you find that the population will go to the areas they need to go for primary healthcare services and leave the hospital for situations that are more severe. So then in that way, when you go to the hospital, you really go to the hospital of things that are necessarily severe and not necessarily be sitting there because you have a little busto or you have a little headache, and then you say, but I'm there from 7 o'clock in the morning and it's 10 o'clock, I'm not being seen, and then you get upset because I've been there for 3 hours, but then somebody else comes there at 8 o'clock or 7:30 after you with a severe abdominal pain that may warrant a surgical intervention. For the triage project at the hospital, that particular person, even though they came after you, because what they have is more severe after being triaged, they will be seen before you, because that's how the hospital operates. Primary health care, for what you have, which might be just a headache or a rash, would have to go to primary health care and try to deliver that. So a lot of education is needed from our end to the public, because we have to let them know the difference between hospital services and primary healthcare services and what services are available, so that the public can use these services appropriately and not feel bad or sad that they went to the wrong service and had to sit and wait when they could have gone somewhere else and be seen much quicker.
Any update regarding the Castries Polyclinic and how soon that is going to be coming on stream? Because you did mention it.
Yes, I don't want to give you timelines as yet. You know, I think a colleague of mine would be better able to say it, because within. But what I could tell you from Ministry of Health and a lot of work is being done to push to ensure that it's done sooner rather than later. So work is being done. A lot of discussion is being made on what we're going to do. The persons responsible for that department, they've been regularly meeting to ensure that this happens. And as I said, when this is going to happen, a lot of communication will go out to the public so that they are aware when persons will start accessing services at the Victoria Hospital under what at Cash Health Center, which will now be moved to a certain section, a certain area within the Victoria Hospital.
Coming back to the matter of the primary health care again, what, 33 health centers around the island or so. And lots of people will say that, well, they want to see a doctor, but they're not guaranteed of seeing a doctor every day at a health center. I know that has been one of those taglines, as things that has to be achieved, having a doctor, a GP in every health
wellness
center every day.
Yes. Okay, so this is one of our challenges, that we have. We are working on it, and when I say we, Ministry of Health, we have departments under Ministry of Health, but we work as a team to ensure that we get physicians to be able to cover as much areas as possible. What I could tell you, there's always a physician, at least one physician in each healthcare region. If you look at persons who understand the healthcare system really well, for instance, they would say that if you go to Health Region 2, you will have different wellness centers in Health Region 2, and you may not have a doctor every single day in that wellness center, but in every region, you would get at least one physician. Okay, so I know the departments are making strides in getting persons to allow wider coverage, and I guess with time that would happen. And under UHC, it's necessary, because if you're looking at health service delivery, you must have sufficient human resource for health. So that is one of the areas that we are working on, and a pillar to ensure that when we do deliver, we have sufficient staffing to ensure that we can give the health care that we want to the population of St. Lucia.
Do we have too many health centers, you think? I know 33 is quite a lot, isn't it?
Yeah, I wouldn't say too many. But of course, internally, the Ministry of Health, we are looking at the services that we provide at the Wellness Center. And it's a constant review of what we provide and educate the public as well on what. Because some persons don't even know that we do, for instance, pap smears at wellness centers. So you have women saying they're not too sure, but all they need to do is pick up the phone and call the wellness center, and the nurse will tell you when you can come and do your pap smear at no cost. Okay, so these are things that we really need to educate and push the public, because the essential package of health service under UHC and anywhere in the world, prevention is better than cure. You really want persons to prevent them from getting ill than to reach the point where you have to treat them, rehabilitate them, or reach the point of palliative care, because you really can't do anything much for them. And UHC moves from promotion to prevention, treatment, rehabilitation, and palliative care. So we really have to work on the promotion, the prevention, to avoid too many people getting to the point where they get ill and they have to go to the hospital.
We're due for a break. We've got to take in our weather report in just a bit. But before we do that, the matter of time, a lot of people, as you mentioned earlier on, they may be thinking, oh boy, to go to a health center, a wellness center, I'm going to have to spend the entire day there. Are we moving towards an appointment-based system? Is that something that is in the works?
That is something that has been in discussion, where we want to, especially when it comes to primary health care. Culturally, if you go to the primary health care, we have a lot of times, a lot of people are out there. The elderly people, sometimes they just like to chill out in that area. That's the chill out spot. But we're really pushing, because the thing about it is that we don't like when persons complain and say they've been there waiting. But if you can actually come at the time that you have an appointment, then the wait is less. And these are changes we have to, behavioral changes. These are the mindsets we have to change to our public and say, okay, you're going to the wellness center, try to not to go for 7 o'clock if your appointment is at 11. But then again, we have to look at other persons might tell you they're elderly, and that is when they can get a ride from their child or the children that's going to work at 8 o'clock. So that is the time they need to drop them. So you have all of these things that we're going to work around. But I think the majority of persons, if they stick, or when we start doing the appointment, if they can stick to that, it will really help us. So it will cut down on that complaint of, I'm sitting down there and waiting for a long while. If your appointment is set to come in the afternoon, then you really don't have to come at 8 or 7 in the morning. You come for 1 if your appointment is at 1:30 or 1:15. And these are some of the things that we have started discussing at the Ministry of Health, and we hope that the public will take it in good strides as we're really trying to cut down on the complaints that we're having. Yeah.
Indeed. We are discussing universal health coverage, tomorrow being Universal Health Coverage Day around the world. And we're having that conversation with the director of universal health coverage in the Ministry of Health, Wellness and Elderly Affairs, Dr. Alicia Eugene Ford. But we're due for a short break to take in our weather report from midday. So we're going to do that at this time. That's all.
This has been The Daily Dish.
One tiles for your home, I see. Bathroom, kitchen, pantry. Need tiles for your balcony. Come down to Tiles Plus, satisfaction guarantee. Tiles Plus, Tiles Plus, Tiles Plus. Big tiles with unbeatable cost. Customer service, A plus. With all kind of tiles, come down to Tiles Plus. We also got gas and vanity. Books, doors, you'll see. Come down to mind nobody. We got the best tiles on island. Trust me. We are located Land Street in Castries, Bosses Grozile, and Flag Street in Beaufort. Telephone number 453-7939.
Make your home merry and bright with Island Style's massive Christmas sale. Our wide range of porcelain and ceramic tiles are on sale up to 50% off. And that's not all. Save up to 15% off. Bathrooms with bundle and save. The more you buy, the more you save. On gorgeous bathroom vanities, bathtubs, faucets, shower glass, toilets, and more. Plus, contractors and tilers are in for a treat with our special discounts on tiling tools and accessories. Sale on now at all locations. Castries, Rodney Bay, and Beaufort. Or call 450-452 or 453-TILE. It's time to deck the halls, deck the walls, or even deck the deck with huge Christmas savings only at Island Style.
This is Radio Caribbean International. It's now time for the weather news.
And that's all, of course, on 1.1. It's now time for your weather report as of 12 noon today, presented by Island Style Talent Bar. The forecast for St. Lucia valid for the next 24 hours. The winds will be blowing from between the east and east-northeast near 21 miles per hour or 33 kilometers per hour. The weather partly cloudy and breezy, becoming cloudy at times with a few brief scattered showers. And there is an advisory in here which reads small craft operators and sea beavers are advised to exercise caution due to brisk winds and locally rough seas. The forecast for the Lesser Antilles, partly cloudy and breezy, becoming cloudy at times with widely scattered showers. The weather summary: the Atlantic high pressure system will continue to generate moderate to brisk easterly winds and locally rough seas across the eastern Caribbean region during the next few days. Patches of low-level clouds drifting along the wind flow will produce some showers over the region during the next 24 hours. And this was a weather report as of 12 noon today, presented by Island Style Talent Bath.
This has been RCI's weather news. For more information, call the weather hotline at 454-3452. RCI 101 number 1.
Make your home merry and bright with Island Style's massive Christmas sale. Our wide range of porcelain and ceramic tiles are on sale up to 50% off. And that's not all. Save up to 15% off. Bathrooms with bundle and save. The more you buy, the more you save. On gorgeous bathroom vanities, bathtubs, faucets, shower glass, toilets, and more. Plus, contractors and tilers are in for a treat with our special discounts on tiling tools and accessories. Sale on now at all locations. Castries, Rodney Bay, and Beaufort. Or call 450-452 or 453-TILE. It's time to deck the halls, deck the walls, or even deck the deck with huge Christmas savings only at Island Style.
And welcome back to the Lunchroom here at Radio Caribbean International for this Monday. And we've been discussing the matter of healthcare, in particular universal health coverage, UHC. As we mark International Universal Health Coverage Day tomorrow, December the 12th. It's being marked all around the world. And of course, the matter of healthcare is certainly has become a major issue that is challenging not just developing countries, but certainly even developed world countries right now who have very mature universal health coverage systems right now. And we've been discussing with Dr. Alicia Eugene Ford, our Director of Universal Health Coverage, as St. Lucia moves towards trying to achieve that UHC goal. And of course, a moving target sometimes, one may say, because of course, as you've been mentioning, the issue of, that basket of services, it has to be shifting. It's growing. Some people want to see more things being included. At the same time, of course, the matter of cost, as you also pointed out, is also another thing that I know the UHC has gone through this process of costing
They're doing
services,
that right now.
and they're doing it again at this
well,
point.
Well, the first of all, the basket of service is already defined. It's a defined basket of service. It doesn't mean in the next 5, 6, 7, 10 years we cannot revisit it, because with travel and trade and changes that are happening, demographic shifts and drifts, we have disease burden changes. So therefore, we never saw COVID-19 coming when it was first done. So, it's a fixed basket of service that we are costing, and the costing is happening as we speak. However, it doesn't mean next few years we're not going to revisit the basket. The basket has to be revisited because our burden of illnesses can change over the years. So that's important, yeah? One of the things I needed to say as well is that knowledge exchanges are important. We had our first knowledge exchange happening right here in St. Lucia, where we had other islands from the Caribbean and countries, international countries, coming down in St. Lucia to have this knowledge exchange with us, because they are at different phases in UHC. Some of them are much more advanced, and others, though we are small islands, they admire what we're doing, our small strides towards UHC, because persons, you do your UHC as you see you can within your country, and that's important. We've also visited other countries as well. Delegates have gone to South Korea, where we've had knowledge exchange in South Korea, Colombia. We've had meetings in Washington, and that's important, because this knowledge exchange is not only to exchange knowledge, but to build some degree of partnership and collaboration. Because depending on the service, let me give you an example, cancer, we will offer some degree of cancer services here in St. Lucia, but depending on the stage the patient is, we may have to go overseas. And therefore, it's important that we have this collaboration with countries or other islands, so that we can guide our patients on where to go when they get to that phase, or if they get to that phase. But as I said, we're really trying to prevent persons from getting to the advanced stages, but we do understand you will get patients that need that type of treatment, and therefore the collaboration between countries, not only for knowledge exchange, but to have that collaboration is needed.
And of course, as we were speaking about a matter of collaboration at the sub-regional level, at the OECS level, how much is being done to look at the pooling of resources in that regard? I mean, I know we do have on some levels in terms of pharmaceutical procurement.
Yes.
But as you rightfully said, you have some islands which are more advanced. I'm thinking of, again, anecdotally, somebody mentioning that they would have gone for services in Antigua and Barbuda.
Yes.
For cancer, because they have some very good center of excellence.
Yes.
How is that working out in terms of that
collaboration?
Partnership?
Well, for UHC, we continue to work together. We had the very first knowledge exchange in October of last year, and we had persons from other islands right here. We had the Minister of Health of Grenada right here with us in St. Lucia for the week. We had persons from other islands as well, Antigua and Barbuda. We also had individuals from Dominica, St. Vincent, and the Grenadines, because we do understand that together it's easier to attain. Although we may not be the same place when we come to health, but we have a lot of similarities. So yes, so that coordination or that collaboration continues, and I foresee that in the future it will be strengthened as we move forward, because as I told you, we learn from each other, and then not only learn from each other, but there are certain times, depending on where we are in the healthcare system or where the patient is, they have to travel overseas. And Antigua, for instance, as I told you, as you did mention, has the Center of Excellence for cancer, but we also have cancer patients going to Martinique as well, going to Colombia and other places, and all the Guyana. So persons at the end of it have the option of where they want to go for many reasons, maybe because of finances, they might have family there, or maybe it's easier for them. So persons, the options need to be there. So the collaboration is necessary.
Is that being considered in terms of the costing of those services, especially in terms of cancer?
Okay, so
and treatment. And
yes, there's certain level. We go to a certain level of treatment, but we do understand after a while you may have to go overseas, and therefore, for now, as I told you, for now we have a defined basket of services. Maybe later, in the next how many years, maybe 5 years, we revisit and we expand the basket which means we have to put more money in there. But for now, we have a certain amount of services that we're giving per disease within or per health service within the basket. So what we want to do is that if a particular patient warrants or needs more than what's available in the basket, we need to have a proper referral system where we can educate and communicate with the patient and give them that level of support so they can move from point A and point B that we have in the basket and bring them to C, D, or ED mini, which is not presently available in the basket. And that's important because sometimes the person they really don't have the information, and they waste time trying to navigate through the system. Where do I go? What do I do? Do we have it here? Do I go overseas? And time is of essence, especially depending on the disease you have. Yeah. So while we have a defined services within the basket that we're costing, the additional services that may be needed, we need to have a proper guidance, have a proper referral system so that the patient knows that coming out of this, now that you're at this point, this is what you need to do. These are your options, and these are the people you need to communicate with. And that not only this, but whichever team that's doing this, we have to ensure that they do the follow-up. I have not seen you. Is everything okay? How are you doing? And not only for the patient, it has to be patient-centered, but also see what the family members are doing. That support system is needed. Because depending on the disease, you need to have a proper support system.
And of course, this is a challenge, no doubt, for healthcare systems around the world. I mean, how much do you wait and allocate for preventative healthcare, primary healthcare, versus, of course, what tends to be the more expensive treatment later on? How is that being sorted out in terms of that financing of how do you apportion resources?
We're having a discussion right now, and I don't want to talk too much about the financing aspect, but we know that we need to, resources need to be given to health to allow it to happen. And one of the things we're also pushing is to change the mindset of St. Lucian, that it's cheaper to prevent than to cure. Because when you treat, it's a lot of money to treat. And therefore, if persons don't focus on prevention, we don't focus on promotion, and we do whatever we have to do, and then when we get ill, we have to then rush to the hospital, and then treatment, which may well be so advanced that it takes a lot of the money, it really wouldn't allow us to get to universal health coverage. So we really have to change our mindset. Yeah, really have to educate the public for them to realize this is the basket of services, but it will do so much more for us, and we would save so much more money if we actually prevent. So that is why we're encouraging people to go to the wellness centers, and as we launch each service, we focus a lot on prevention, and we know we're going to have patients that we have to treat for sure, and that is catered for, but we want the majority of people to try to come to prevent before getting to the point where the majority of them have to be treated. Yeah.
But for a lot of people, that's already a message too late.
Yes, because we have persons who are already advanced,
who are very advanced,
and they're already at that point, so we don't have a choice but to treat them, because UHC takes into consideration promotion, prevention, treatment, rehabilitation, and palliative care, because some diseases you really can't, at that point, wherever they are at the advanced stage, we can't really cure them, but we can make them live as comfortably as possible, until they decide to cross over, or God decides to take them over.
And of course, you did say that there's so many aspects in terms of the policy matters going on right now. Public consultation, is that going to be part of it?
Yes,
especially when that white paper comes out?
Yes, definitely. So part of the route or the discussion when it comes to the universal health coverage white paper, which is the roadmap, is national consultation. So we have the lead drafter and the co-lead drafter who's working on the paper, and then they are quite away. One of the major deliverables under that consultancy is to have national consultation. And the national consultation, we'll be having obviously St. Lucia, but we'll also open it up to the diaspora, because we have St. Lucians overseas who are quite interested in what's happening, and we think it's necessary to open up so that they can give their feedback on that roadmap. So they are aware that is something that has to happen this coming year, and we really want it to happen within the first quarter of 2024.
And will there also be a discussion on the financing aspects as well?
Yes.
Because
the
obviously
white
that's
paper, yes.
always a very contentious
The white paper
matter.
takes into all the pillars. Human resource for health, health management information system, which is very important, because you have to connect all the health management information system. It takes into consideration the registration, the business rules, etc. The finance aspect of it is important. So that is why all what we're doing on the health financing policy and strategy, all the discussions we're having on the health management information system, all discussions we're having on service delivery and human resource for health, etc., the procurement of medication and equipment, this particular drafter has to be informed because it has to inform the white paper. It has to inform the white paper. And then when this is as completed, one of the deliverables is to have national consultations. Because after national consultation, you get feedback and you realize, hey, you need to go back and change a few things, or you may very well have to strengthen a few things, or you educate them and say, listen, this is what it is, and this is how we have to go and why we have to go that route.
Besides the matter of, the epidemiological data that you're looking at and whatnot, will people actually be able to opine? I mean, to say that, hey, we think there should be more services in here.
In the basket.
In the basket.
Okay.
And they may decide, look, this is nice, but it's not enough. We think there should be a greater, a broader health coverage.
Okay.
And that, I mean, how do you respond to those types of situations?
Okay.
Will there be an opportunity to be able to have that?
Well, last year, 12th of December last year, we had a public survey asking persons what they want in the basket.
How was that feedback?
It went well. It went well. What we found out, though, is that it went well. We got more persons than we anticipated. And one of the nice things about it is that what they were asking for is what we had in the basket.
Okay. Yeah.
There's one particular situation we're going to just clarify in a bit, because we found out persons were also asking about care for their children, more care for their children, maybe possibly looking at care. They may have thought more of care, after school care, or care for kindergarten care, or that's a child care versus pediatric care. Yeah, because persons interpret things differently. So maybe for us healthcare workers, when we say child care, it may not be child care for somebody else, a layman.
But it's interesting that they're seeing it within that context of healthcare.
Exactly.
Yeah.
So that is something we noted. But the nice thing about it is that we had persons from the older population, younger population, a wide participating, and a lot of what they want. In fact, all what they said, we had it in the basket. We had it in the basket. And that for me was a big thing. I was like, okay, there was no additional service that they came up. They spoke about eye care,
validation
they
there
spoke about dental care, they spoke about certain things, COPD, we had it in the basket. So I was happy that what they wanted, because that was one of the first things we wanted, to know what exactly the population want. We at the Ministry of Health, we have our epidemiological data of what burdens, what's our burden, what makes us ill, and what kills us. But then, what does the population want? And that was important. So that is why we launched that survey last year. On the 12th of December, we launched it, and it was open for 6 weeks.
Right.
So by the ending of January, that is when we closed it up, and then we analyzed it and we realized that the services that we had in the basket is really what they wanted. And we were happy for that. That for me was very important.
The area of, I suppose, gerontological care or elderly care,
yes.
and also palliative care, as you mentioned. I mean, that is a huge issue worldwide right now,
Yes.
especially in the developed world.
Geriatry.
And we're seeing, of course, people saying that, look, they actually want to come and retire in St. Lucia because they can actually afford the care that's available here. Is that potentially an opportunity in terms of our health system, in terms of what we can actually offer to other parts of the world?
This is something that the Ministry of Health is looking towards, because the Ministry of Health, Wellness and Elderly Affairs, So that elderly affairs is very important, because we have to ensure that we look into the elderly care. Presently, we have discussions going. I know there's ongoing discussions, and the ministry is looking into ensuring that this particular arm of the Ministry of Health is taken care of. So I foresee that geriatric care and all of the other things related to elderly people will be given more importance in the upcoming months, because it is Ministry of Health, Wellness, which is important, but as well elderly affairs. Yeah?
Right.
And that's important.
And of course, the whole concept of assistive care, people not necessarily wanting to be in a home purely, but
at home, and having persons come to their home to take care of them. And these are things that all is in all part of the discussion, because elderly care would involve not only going to the homes, but persons want to be at home, and family members probably want somebody to go across and care. So these are things, and I'm happy to say that elderly care is a new attachment, because Ministry of Health, Wellness, and now you have elderly care. But I know for sure our PS of health have had discussions with relevant individuals to ensure that this is something that is going to happen. And of course, the Minister of Health, who is very much into, that's Honorable Moses Baptiste, who is very much passionate about universal health coverage and passionate about things in the ministry, like the PS. While we focus on health and wellness, focus will be given on elderly affairs. So you would notice next year, you probably have somebody come on your show and talk more about the focus on the elderly, which is very important because we have an aging population.
Indeed. And of course, we don't have very much time left, of course, but we have a wrap up. You have some activities coming up, I take it, to mark this?
Just not activities, because I did mention what we're going to come in looking at screening, etc., prostate, cervical cancer, etc., chronic kidney disease. But I just want to let persons know that we had a naming and logo competition that started off to ending of July, and we we closed it up on the 6th of October.
So this is for UHC
name and logo. Okay, and then we had at least 133 submissions, and we had some judges on the panel, persons like, just to mention a few, Giovanni Santome, we had people like Ted Sandiford, Johnny Mudovic, etc., Nigel Nicholas, and we had our graphic artist from the Ministry of Health as well. It's important that they participated. We had at least 133 individuals, all age groups participated. So we had the winner, and the winning name and logo was actually displayed on the 26th of October in the runners-up as well. She had some good submissions in the Constitution Park. But I just want you to know, and the rest of St. Lucia to know, that we're doing some minor tweaks to the name and logo, and we've placed in a tagline. So by early next year, we'll have a nice name, logo, and tagline for UHC, and then we'll be able to proceed with some of activities, which means putting up on billboards on the sides of the road throughout the island, wrapping vehicles. You know, we have a UHC song as well that we had the Calypsonian ready, prepare for us, you know, and therefore when persons hear a song or see the logo and the name and the tagline, they will remember universal health coverage and what it means to them, because not only what Ministry of Health and the government of St. Lucia is doing, but what is every single person their role in universal health coverage, because they need to access the services and they need to do their part as well. So these are some of the things that are upcoming that I'm really excited about.
How important is that in terms of the branding, as you also mentioned, the matter of private partnership? Is it going to become a point where you're going to have some doctors coming on board or private clinicians coming on board?
UHC?
Yeah, and are they going to be identified as a UHC?
Definitely. We already started that because, for instance, chronic kidney disease. First, to do the training of our physicians in primary health care to do the screening, I had to bring the nephrologist from OKUH, okay, for us to be able to run the services at primary health care, so that somebody with chronic kidney disease was screened and found out, oh my, you have the kidney failure, and then you have to see the internist, you have to see the nutritionist, you have to see the nephrologist. We have the nephrologist in already assisting. Training, we have consultants who will be coming in, we'll be engaging them to do the training, because as we move on from breast cancer to cervical cancer to prostate cancer, you know, you have to bring in the urologist, you have to bring in obstetrician gynecologist, depending on the type of cancer, depending on the disease. We do not have a choice but to engage our colleagues in the private sector, because some of them, they work at the hospitals, but some of them, in addition to working at the hospital, they work in a private capacity, and therefore we need to engage them so that they be able to do the relevant training on ground for us, engage them so that be able, because as I said, for us to be able to attain UHC, we need to really have public-private partnership engagement, because our human resource, we have to see what's on island to work towards that.
And in fact, that was going to be my final question about the whole matter of human resources and the challenges there with attrition across the healthcare sector. Is UHC in any way addressing this in terms of how to tackle this issue of medical practitioner flight?
Yes. Okay, so we have, for instance, the nurses. You know, the nurses have been living, you know, going to greener pastures, etc. One of the things I would say is that our chief nursing officer, that is Nurse Kirpney Suraj, she have been working with the other nurses on board to do what you call a retention plan. And then it's not only to retain them, but also ensure that we have more nurses in the pool. Okay? I don't want to talk too much on it to say all the different plans, because at the end of it has to be approved to make sure this goes through. But when she explained, it's really nice that I think with that, if it actually goes through, it will allow the nurses to stay. Yeah, of course you'll have a few that may still go, but at least you have more that will probably want to stay. And also it'll give opportunity to younger people to go or gravitate into nursing, and that's important. We're also looking at not only nurses, but we have to look at other kinds of skill set as well. What we're going to do, we're looking at it as well. What do we do at councils level to ensure that we have more people coming on ground to be able to provide the assistance for us, as well as cooperation with other countries. You know, we've been having cooperation with Cuba and some other countries as well. Sometimes our training as well. We're also looking at telemedicine, because sometimes what we do is that you don't have to necessarily leave your country and go to another country to get the necessary training. You can actually do online or telemedicine to allow that training to happen. We're also looking at having persons, for instance, we just went to Martinique recently, and we had a delegation to Martinique. We went recently with the minister, the PS, CMO, and some of my other colleagues. And then they want to start back what we used to do some years ago, where the specialist comes from Martinique and come on ground. So instead of having persons go to Martinique, the specialist can come down, get registered for a period of time, and do the necessary work in St. Lucia. So our patients don't have to go abroad. They're right here in St. Lucia, and we can twin them with our specialist in St. Lucia. So there's a knowledge exchange that happens. So they're looking at ways in which we can improve that kind of service. Okay, how we retain people, how we have more persons come into it, but what we can do digitally, what can we do electronically? The world is changing. What can we do to make our collaboration in such a way between islands and countries tight, so that we can have that cooperation, they can come on ground and serve our persons, and the training can be done in such a way that we don't lose our staff, but they get trained at the same time.
Wonderful. And that's all the time we have, actually, Dr. Eugene Ford. Of course, we've been discussing here at the lunchroom the matter of universal health coverage. And it's one of our final programs here, a very important one as we move into the year 2024. Any parting thoughts on this very important, as we mark Universal Health Coverage Day tomorrow?
Just want to tell people, don't forget, tomorrow is International Universal Health Coverage Day, and the theme is Health for All, Time for Action. But we also want to take the opportunity to let persons know that we want them to think of universal health coverage from prevention, promotion, prevention, right across. But don't forget, the prevention is very important. And we also want persons to know that we continue to work at the Ministry of Health, Wellness and Elderly Affairs to ensure that we deliver the services we have to deliver under UHC. We want to thank everybody, including your team, but we really want to thank the public for using the services and giving us feedback via the online survey, or whether it's hard copy survey at the Wellness Center, calling in. We also want to thank our team at the Ministry of Health, my small team, but and by extension, the departments under the Ministry of Health that work together to allow this to happen. Persons from the public and private sector, the sister ministries and the private sector, as well as individual other agencies like the World Bank and Pan American Health Organization that have been holding our hands and working with us to allow a lot of things to happen. So we know that we need to work together so that we can attain universal health coverage for our small St. Lucia. On that note, thank you.
Thank you so very much, Dr. Alicia Eugene Ford, Director of Universal Health Coverage in the Department of Health, Wellness and Elderly Affairs. And of course, thanks to all those who've been listening. We will be back tomorrow for our final program for the year. Hope you can join us for that here on Radio Caribbean International. Have yourself a very blessed day. I'm your host, Alex George Jr., saying goodbye.